I was having some pain in my gum, and I suspected there was something wrong with one of my teeth. And sure enough, my normal dentist told me that the tooth would have to come out.
In Anne's case, the idea was to be able to take the impression the same day that the implant went in. The day the implant was put in, before she left, I was able to take the digital impression. The purpose of the digital impression is to save the patient the aggravation of the old-fashioned impression where you need a tray with all the impression materials setting in the mouth. By using the digital impression, not only is that information gained relatively easily, but it can then be emailed to the laboratory.
The digital impression helps the restorative dentist and benefits the patient by allowing parts of the restorative process to happen at the time of surgery. And if we have that information available to us at the time of surgery, it can be used down the road when it's time to make the final crown months in advance.
Once the laboratory has this information, they can go ahead and make the final crown during the osseointegration phase. This allows for the patient to return to the general dentist and have the crown already waiting for them for insertion. This will save time, and it also saves the additional laboratory costs involved in pouring models and using parts which are no longer necessary because now it's a digital impression.
They explained what they were going to be doing, and it was not uncomfortable or a problem at all. The fact that I could have the digital impression done the day that my implant was put in was very convenient for me. I think it was convenient for my dentist, and it also saved me from having to have the tray put in my mouth with the material that I can imagine doesn't taste very good, and saved me a lot of time, which is very convenient.
Another advantage with the scanner is that it does automatic shade matching. So rather than relying on the old-fashioned way of trying to figure out what shade the tooth is, the scanner is able to elicit a number of different shades within the same tooth so the laboratory can have the best chance of matching it.
The interface between Dr. Kubikian and my primary dentist was very smooth, very efficient, and very quick. The fact that he could have my crown come from the lab after the impression was done was really kind of amazing to me and saved a lot of time and was very convenient.